Hey guys, welcome back. Today's video is on acne, and I haven't done a video in over a year on this topic, so I thought I would put that right by covering what is the best way to treat acne in 2022. Now, acne remains a big deal, perhaps the biggest deal when it comes to skincare, and that's because so many of you are affected. As many as 85% of teens and 50%, that is right, 50 of 20 to 29-year-olds are also affected. But particularly when it comes to us women, it seems like we're blighted by breakouts at all points of life, whether it's puberty, whether it's starting the contraceptive pill, getting pregnant, IVF, the menopause. All of it can have a negative impact on the way our skin behaves. Now, acne is undoubtedly one of the most emotive topics in skincare. Anger, frustration, sadness, despair. These are things I've experienced myself when my skin was behaving unpredictably, and it's the language my patients use. Now, the thing about solving a problem like this is managing expectations, because with acne, when you start treatment, there is a significant time lag between making that plan and actually seeing results. It's in the order of 6 to 12 weeks before you can really start to expect to see things get better. So that's why it's important to have a plan and to know the milestones so you have realistic expectations. And I really do think that's the secret to making a successful plan. So we need a goal. That might be go makeup free to the gym. And we need some milestones to allow us to focus on the nearer term. So that might be fewer blemishes per week. It might be less duration of blemishes. So things that will happen sooner than that go makeup free milestone, but that show us that we're getting better. So that's really important. The next thing is to set a realistic time frame, as I said. So we're not talking about overnight success, we're even talking about success in a week. A skin cycle is 6 weeks, so 1 to 2 skin cycles are the correct time frames for significant improvement. Then we need a plan, and I like this to be written down, dosed, really detailed. I'm going to help you do that today. And then the final thing you might want to build in are rewards. So some kind of treat that you reward yourself with to keep you on the path, motivated and strong. Now let's talk about the acne process itself. How do you get acne? Reassuringly, it's nothing that you're doing. It's simply not your fault. It is a consequence of your genes. And whilst you might have that annoying sibling who doesn't have any breakouts at all, it's not down to just one gene, it's a whole constellation. But the frequency with which we see it in Western society suggests that it's the interaction of how we're made, our genetic makeup, with some elements in the Western way of living, diet, environment. Doesn't really matter. At the end of the day, it's common and it needs managing. Now, the things that we know can exacerbate that tendency, the top 3 are stress. Stress is a big one, and just look at teens before exams, right? It's so common for them to break out again as to be normal. But this is because stress hormones behave a bit like the hormones we experience before our period. It makes our oil glands more active, it makes our skin more prone to clogging up. Second one is the effect of hormones themselves, and we particularly see this in things like the morning after pill or the period delay pill, usually related to high doses of progestogens. Pregnancy is also a progestogen positive state, and that's why the first trimester can often be a bit stormy for skin. And conditions where our androgen levels are altered, so for example in polycystic ovarian syndrome, we also see an increased tendency to break out. So there are lots of ways in which our hormones can influence our skin. It doesn't always mean there's a disease at play, but it's certainly worth being conscious of when it comes to contraception, IVF, and so forth. And number 3 is cosmetics and skincare. So making the wrong choices in the products you use every day can often lead to worsening of acne. And this is something I saw 10 years ago when I started private practice. And I was overwhelmed with people coming to me with these complicated skincare routines and really not understanding the link between that and why their skin was breaking out more. So rationalizing your skincare routine and your cosmetic practices is fundamental when it comes to getting a handle on acne. Now, the language that we use around acne and breakouts is confusing. We talk about pimples, zits, spots, comedones, clogged pores. Are they all the same thing? Are they different? Well, the reality is that the same process underpins all of them. So whether it's just simply a blocked pore, where at the base of it we see comedone formations, the sticky skin cells combined with cloggy oil to block off the opening of the sebaceous gland as it passes up onto the surface of the skin. That's what we call a comedone, and that really is the core lesion, whether we're talking about simple congestion, another term, or we're talking about full-blown nodules and cysts. So everything in between is really just about the way your body reacts to that clog pore forming in the first place. So the clog happens, then a group of bacteria that are anaerobic, they don't use oxygen, can basically have a great time. They're now safe in that oily environment. So they proliferate and grow in number, and then the body reacts to that, creating inflammation. Now, that might mean you get a tiny red bump, what we call a papule. It might have a white head, that's called a pustule, or it might become really angry, deep-seated right down into the dermis, forming nodules and cysts. Either way, the process is the same. So when it comes to what acne looks like, it depends on how much inflammation is generated. So if you are someone who just gets clogged pores or congestion, you'll experience blind skin-colored bumps, often seen on the lower part of the cheek and jawline in women with adult acne. And each of those is a blocked pore, which might in theory become inflamed and develop into a blemish later on. But there are those who simply sit there with these clogged pores and they don't do anything. It's what we call uninflammatory acne. Similarly, you might get someone at the other end of the spectrum who gets deep inflammation. It's a risk of scarring, and that's what we call nodules and cyst formation. And in the middle, you get papules and pustules, perhaps the most common pattern and typically seen in either the T-zone or in the U of the face, depending on age and demographics and so forth. Now, speaking of distribution, it's often thought by Google that the pattern of your acne reveals something, that it suggests something to do with your diet or a deficiency of sorts. Now, whilst we certainly recognize certain patterns, the T-zone of teen acne, the U-zone of adult female pattern acne, other patterns are really less causally linked. So we might see someone with blocked pores and the occasional blemish in the forehead who's been using products on their hair, for example, that have caused the pores to become occluded. It's what we call acne cosmetica. Then there are those who may have developed breakouts at the sites of friction. So I've seen this with somebody who's worn a cycling helmet where the strap under the chin has led to breakouts as well. We see it sometimes on the body, particularly with those who wear tight-fitting gym gear in a hot, sweaty environment. That can trigger breakouts. But aside from those typical patterns, I really don't associate any other zones on the face with anything else being wrong. So rest assured on that front. Now, perhaps the most poignant question someone asks me when they come to see me in clinic is, will my acne go away? And the answer is possibly. Depends. If someone's coming to see me later in life, in their late 30s or their 40s, clearly there are strong genetics at play. But in a way, I think that the age of presentation is less important, because ultimately, when we put in place a sound, evidence-based plan to manage breakouts in acne, the great news is we're putting in place what is actually usually a very sound skincare routine for facing off the future. Retinoids, azelaic acid, niacinamide, non-clogging skincare, and great use of sunscreen. These are the key components of any great anti-breakout routine. And they're also a fantastic way to approach premature aging and making your skin look its glowy best. So I find that question to be somewhat redundant because there is no downside to putting these steps in place. So just to recap, today we've covered why this video is important. We've covered what acne is, where it occurs, what it means when it occurs, and we've talked about a really good framework for building a successful acne strategy, one that I want you to remember when it comes to next week's video, where I go into the detail of how best to put together that essential breakouts plan. Thank you so much for joining me. We're going to get through this together, and I look forward to seeing you again next week. Bye for now.